Welcome back to American Agenda. We are continuing to follow the tragic announcement about the Princess of Wales, Kate Middleton, cancer diagnosis. Now, the princess gave a taped announcement a short time ago, and joining us now for more on this, doctor and U.S. Senate candidate from Nevada, Dr. Jeff Gunter, and board-certified OBGYN and advisory board member for the American College of Surgeons, Dr. Greg Marchand. Dr. Marchand, tell us what is next. We don't know what stage of cancer. We don't know what type of cancer. We are, of course, guessing it is in the abdominal region where she did have surgery, and that's when they detected the cancer. So where does she go from here?
Well, like you, it was pretty sad, and I just recently saw that video and learned that the Princess of Wales is now one of the more than 8 million women around the world each year who's diagnosed with cancer. Just having to go by what little information we have, she has asked for privacy, so we don't know exactly what type of cancer she has or exactly what stage. But the fact that they started off with surgery is overall a good prognostic indicator for the surgery. More advanced cancers are less likely to be treated with surgery first and more likely to be treated with chemotherapy, radiation, or other therapies first. So that is a good sign. And she did indicate that she had caught things in the early stages in her video. So I'm optimistic about her prognosis with assuming that everything that she said during that video is true. It sounds like they're going to do some follow-up chemotherapy. So she'll likely have a long road ahead of her with a lot of symptoms and feeling quite ill with the chemotherapy. I'm optimistic based on what she's told us at that video that she's likely to make a recovery.
Dr. Gunter, we're understanding that Kate had a surgery for an abdominal issue. Then the cancer was later detected here. Is that common, after some tests for it to be diagnosed afterwards? Is that good? Is that bad? We're just going on the facts that we know at this moment.
Well, first of all, I just want to commend the video that she put out. I thought it was brave. I thought it was strong. I thought it was honest. And I thought it was inspiring for, like your other guest said, the millions of women who struggle with cancer every year. So I really do commend them all on her message. I think it is a good sign. It's generally a good thing when they think that something is probably a benign lesion. And then after they send it off to pathology and they examine further, assuming that's what happened, they find that there is a malignancy. And like your guest said, it's a good way to start. She had the surgery. They did not start with chemotherapy or other matters. So I think so far, so good for the royal family. And I really do commend her. I think when celebrities like her and role models like her step up and step forward, I think what they do is they emphasize early diagnosis and preventional care. So when you can catch tumors when they're small, when you can catch tumors before they've spread, that creates a good prognosis. So a lot of bravery and a great public announcement from the royal family, and God bless her, and we all wish her a speedy recovery.
Yeah, excellent points there, Dr. Gunter. Dr. Marchand, I want to kind of continue the conversation to what Jeff said regarding this is almost a good role model moment when a celebrity actually comes forward and does bring awareness to something that happens to millions and millions of people around the world. And I think also to King Charles, who specifically said that he was diagnosed with cancer and that he was going to undergo treatment. Again, saying he wanted to be transparent. A lot of people say, oh, who cares what the royals do? But in this case, whether you love them or hate them, what they're both doing with the transparency could actually save people.
I agree with you 100% there. Treating cancer patients, one of the worst things a cancer patient can sink into is depression. And often you have that type of depression that sinks in when you feel like you're alone, that no one else is going through this, that you're facing at the end of your life and there's really nowhere to turn. So I do think it's a very good thing when a public role model like this, someone that a lot of people look up to, is showing the world what she's facing, showing the world that she is also a human and she's also facing this diagnosis. And I hope this gives hope to a lot of women that are facing a cancer diagnosis. And as you already indicated, I hope this does draw some attention to preventative screenings. Preventative screenings, annual exams are very, very important, not just in the United Kingdom, but in the United States as well.
All right. Excellent commentary and advice from both of you. Appreciate it. Doctors Jeff Gunter and Greg Marchand, thank you so much for joining us, especially on such short notice. We really appreciate it.
Thank you.
Pleasure.
Okay, still ahead.